Hello, I'm Dr. Pravin Jain. I'm consultant rheumatologist and I'm dealing with various autoimmune and rheumatological conditions. So there are various types of autoimmune and rheumatological conditions which sometimes they are related to only joints, sometimes other important organs. So there are always doubts or why follow-up is important. For the proper treatment, diagnosis is important, and with diagnosis, treatment, and the other important thing is follow-up. So without the follow-up, the entire treatment may be of waste. So the question is why we should do follow-up. If you do follow-up, we'll come to know the condition of the patient, whether it's improving or deteriorating. So according to that, we can either change the dosage or not. With proper follow-up, we'll come to know whether his compliance is good or not, whether he's taking a proper dose at proper time or not. So these are cross checks. So with proper follow-up and with we'll come to the patient's symptoms, and with the blood test we'll come to know whether he is improving, whether there is any side effects or any drug related toxicities. So we have come to know what is the importance for follow-up. But how do we follow up? What are the things we should see? So most important thing is how is the patient feeling. So generally the patient says I am feeling little improvement, good improvement. Sometimes we are asked in terms of percentage wise also, like 20%, 50%, 80%. So this will give us some idea how is the patient improvement and how much is our target and how much is yet to achieve. And this is a subjective thing, means how is he feeling, but he wants some objective thing also. So this we do with the help of blood tests. So blood tests are simple tests like hemoglobin, liver, kidney and other things. We don't do this special test regularly. Special test mostly we do for diagnosis, but follow-up simple tests are sufficient, which are not very costly. So there are various methods to see in the follow-up. As I said, one is symptoms, other thing is objectives with the help of this blood test and all. Other things we will also see how is he compliant, is he taking properly or not. And sometimes we have to inform the patient, we have to guide the patient, we have to motivate the patients about this disease and how to follow up regularly. There is always a question that why you do frequent blood tests. Rheumatological cases or autoimmune cases are not simple. They are long standing. They might be a few months, few years, and frequently they have ups and downs. So that's why we have to keep on monitoring it. So on follow-up, we'll just see subjectively, as I said, how is he. But with blood tests, we'll come to know if there is any side effects which is started now, or whether the disease is starting flare up. So with the help of blood test, we can easily capture or we can have early capture of the disease and prevent the flare and prevent the disease toxicity and organ damage. So with this blood test, we are checking few parameters of the important organs, like we'll see the hemoglobin, means whether it's improving, decreasing. In even small correction in the hemoglobin itself will improve the symptoms, the fatigue will come down. So similarly, if you test for liver, kidney, urine, which may get affected either by medicines or either by disease. So we do preliminary checkup. If sometimes if required, then we may do some special tests. But most of the time, it's a simple test. And it's not that we'll do every monthly. So we'll see the disease response and then we'll increase the duration of the visit, and then we'll do the blood test probably every 2 months or 3 months, sometimes every 6 months also. Suppose if you skip the follow-up, so we'll miss the few signs or few indicators whether the disease is worsening or not, and whether the patient is having side effects or not. So if we come regularly, we can capture it early. If we delay it or if we skip it, then the patient may go into organ damage, either because of disease or either because of medicines. So as I said, follow-up is a very important part of the treatment, and this follow-up is similar to like how we do in diabetes. In diabetes, we do follow-up by sugar levels, in BP, in hypertension with BP levels. So similarly, we have a follow-up in rheumatoid disease also. So we see with symptoms and investigations and all. So follow-up is not an option. It's an important part, and probably we'll say it's a compulsory. It has to be taken seriously. And this follow-up will reduce the further toxicities, further issues, further organ damage. Only with simple regular follow-up. It's a part of the discipline of the treatment. Okay, thank you.